Hello and welcome. Thank you so much for joining us today. I am so happy to have my county commissioner, Eileen Higgins with Miami-Dade County District 5. Thank you so much, Commissioner, for joining us here today.
Well, it's a pleasure to be here with you today as my constituent.
Yes, I am so happy that you're my commissioner, and I wanted to have you on today. First of all, since we're talking about that I am your constituent, tell us where is your district within Miami-Dade County? What cities are inside your district?
So my district is, I call it wide and skinny, and it's filled with water. It literally starts at the beach, the ocean, has about half of the city of Miami Beach, comes across the MacArthur Causeway. So I have some very fancy constituents on Fisher Island, then comes down to downtown in Brickell, Shenandoah, the roads, and then continues west to Little Havana. So it's an incredibly diverse district because we have the wealthiest people in the United States of America on Fisher Island. And then, we have great need in East Little Havana, where the average family of four makes only about $22,000, $23,000 a year. So the needs are diverse and different, but that's what makes this district so special, I think, is there's a lot going on, a lot of ways to help people. And sometimes the help we give them grows the top of the economy, right? You're working on the business end of things, but on the other side of things, you're really working on lifting people out of poverty.
Well, that's exactly right. That's one of the reasons I love living in this district. It is so varied, so diverse. You can find so many different things close by, and that's one of its great strengths. And also brings challenges, especially when we face a pandemic like COVID-19 that we've been facing today, this week. We are now hitting March, so we are hitting a year when we realized that the pandemic was upon us. You have, and the county has worked on many things to help, especially those people that are so in need in your district. And not only that, not only the residents, but also all of the small businesses. And so let's talk a little bit about some of these programs. Let's begin with an announcement that was made this week about rental assistance for tenants within Miami-Dade County. Tell us, and I know that you were one of the sponsors of this item, so tell us a little bit about who can apply, how does this work?
Well, I'll tell you who can apply. I sponsored the original item in July, so we got almost $20 million of aid out then to people that were—
July 2020.
July 2020, last year. Mm-hmm. And we were fortunate enough to receive another $60 million from the federal government, and that will enable us to help many thousands of families in the county. This program, there's kind of three requirements. You have to have lost income due to COVID. And for many people, that's easy to prove, right? They have their unemployment checks, their hours have been cut, and they'll be able to show that. The other piece of this program, it is really designed for low and medium income people or families. So it's really designed to help folks that are struggling. And we will pay the rent directly to your landlord. Mm-hmm. And what's important about that is the landlord will be signing some paperwork that says they have no plans on evicting you. So it's a really good system where we help you, we help your landlord, because these landlords are struggling. Right? When people don't pay the rent, it's a trickle up problem. They don't pay the landlord doesn't pay the banks get mad. That's not a good thing. Mm-hmm. And this way, we're able to help people that are desperately afraid they'll lose their homes, but we are also able to help landlords that are afraid they'll lose their businesses.
And that's so critical because we are always talking about, and rightly so, renters and how to make sure that they are not evicted from their homes because they have lost, in many cases, renters are somewhere in the middle or low income range. And so therefore are the most vulnerable at losing income when we hit a crisis such as this pandemic. And we always think about the renters, which is very important, absolutely, because we need to take care of our most needy. However, we also have to think about the landlords who could get their properties repossessed by a bank, and that creates a whole other series of a crisis, of a real estate crisis right here, and it affects property taxes, services, taking care of the property. So this program helps landlords, and it also helps tenants. So it helps everyone to kind of weather the storm. Is there a maximum? Do we know how many you guys, is it by money? How does this going to work?
So what we'll do is we'll look at your family income and your rent. Basically, we can pay up to $3,000 a month, and we can do it for up to a year. So there really is an opportunity. If you've already 6 months or 9 months behind on your rent, we can go backwards and help you get caught up. The other important thing to know is the city of Miami and the city of Hialeah also receive money. Mm-hmm. And if you're a resident of Hialeah or a resident of the city of Miami, you will apply through your city. But so it may seem like there's 3 different pockets, but the good news is that means our county has over $80 million in rental relief, which is also relief for the landlords, as you so ably described.
Now, this interview is in English, and I am going to put on some information right here on the screen to reach your office. Pero la comisionada Eileen Higgins también habla español y lo habla bastante bien. Así que se puede comunicar con todos los residentes de la Pequeña Habana, de Shenandoah, que es mi zona. Comisionada, ¿ustedes tienen gente que ayuda en español en su oficina?
Sí, todo mi equipo habla español. Entonces, cuando una persona llame, podemos responder en el idioma que es más cómodo para la persona. Y entonces llame a nuestra oficina con preguntas sobre este programa del alquiler o programas de negocios pequeños o todo eso. Y podemos ponerse en contacto con la persona que puede darle. Por ejemplo, muchas personas nos llaman sobre problemas en el pago de cuentas de la electricidad. El condado también tiene programas para ayudar personas con necesidades con estas cuentas, no solamente con el alquiler.
Muy importante, las cuentas de luz. I'm going to switch back to English. Antes de irme del inglés, aquí está el número de teléfono que pueden llamar. Esa es la oficina de la comisionada Eileen Higgins. Todo lo que estamos hablando aquí hoy y mucha más ayuda pueden conseguir y con este teléfono 305-375-5924, y aquí está en la página web, o simplemente pone Commissioner Eileen Higgins en Google y la pueden encontrar. Exactamente. In English, yes, not only, you just mentioned in Spanish that not only does the county offer rental assistance, but there is also other kind of assistance.
There's lots of other kinds of assistance. So if you or someone you know is struggling, because if you can't pay the rent, you may also be struggling to pay your electric bill. And there are programs that can help with that. So reach out to us. You can, if you want to call us directly, it's fantastic. 311 if you prefer doing it that way. But there are programs, take advantage of them. For very, very low income people, want to make sure everybody is able to get the SNAP benefits they deserve. Many families never got food assistance until the pandemic. They always worked and were able to make ends meet. And as I say to them, for years, you've been giving tax money up to Washington to help others. Now it's your turn to be helped. It's your own money helping you, right? This is money that comes from us, we the people. And so if you need that for groceries, we can point you in the right direction to help anyone get set up on that program or others.
That's the way to look at it. Exactly. These are your tax dollars at work.
Yeah.
I'm going to just remind people that are joining us now that right now we have Commissioner Eileen Higgins from Miami-Dade County District 5, and we are discussing many things, focusing specifically on help and programs during the pandemic, COVID-19, which we're all going through and going on a year this month of the time when it really hit Miami-Dade County and we realized what was going to go on. And then we knew that this would be a long-term thing. We spoke about rental assistance. Now your office has also undertaken helping the seniors, which of course have been so affected by this pandemic. Many of them weren't able to leave their homes for months. And now that the vaccines have been going on for a couple of months in Miami-Dade County, 65 and over, a lot of them have been vaccinated. However, it has been difficult to reach those seniors that are more low income, that perhaps are not computer savvy, and that has been extremely, extremely difficult. What work has your office done to be able to reach these seniors?
So we have two kinds of, we have seniors that are more sophisticated. We also have low-income seniors that live in larger apartment buildings. They're easy to reach. We know there's 100 people in this building, there's 80 people in this building. So they may not have internet access or all of that, but we can go to them. Mm-hmm. And so one vaccination program, we literally took a site which has almost 1,000 seniors and actually went and vaccinated them there. Why should they try to find a ride or get their kids or figure out how to get the bus to a vaccination site? It makes no sense when it's that number of people and we could just go there. The other seniors in low-income neighborhoods are harder to reach because they may live in their own apartment. They may, in their smaller apartment, they don't have internet access. Maybe their kids don't live anywhere near them or their grandkids. And the county, after a month of vaccinations, and I passed legislation that the vaccines have to be equitably distributed, right? It cannot just be going to these fancy zip codes, which, by the way, is what was happening, right? Mm-hmm. And we had a month of data and you looked at the zip code map, and if you were in a fancy, richer neighborhood, you were more likely to have gotten your first shot than if you were in a Black neighborhood or in a poor neighborhood. And we began to brainstorm how do we deal with that, and began to connect a program with churches. And in Little Havana, we have lots of little churches, and we reached out to Father Centeno at San Juan Bosco and said, do you mind? You have a bigger church and you have more facilities. Do you mind if we use your church as a vaccination site? And he said, okay. But we worked with 8 churches in Little Havana to find 500 seniors, because these pastors, these priests, these nuns, they know who's trapped in their home, who's alone, who's not sophisticated. And they also know how to contact them, how to reach them. And quite frankly, sometimes with little church vans, how to get them places. Mm-hmm. And so we had 8 different churches. We actually kicked off with a beautiful prayer circle, just because it was so nice to have all of these people from all these different faiths hosted at San Juan Bosco, and they received their vaccinations. And as a matter of fact, yesterday? No, Friday.
Back, yes.
Last Friday. Gosh, time flies. Yes. They received their second shot. It's again, if we want to be reaching the most vulnerable, we have to be creative. We cannot expect them to just sign up on a website. That's not going to happen. We have to find them.
Yes, and that's exactly right. And you could see the divide. It was a digital divide. It's who has access to internet. I personally can tell you that I have facilitated no less than 20 between my husband and I, we have facilitated no less than 20 to 30 vaccines for not only the elderly in our family. I don't want them to hear me call them elderly.
No.
But in our family, the seniors in our family, as well as their friends, because, their kids may be out of town, they live out of town, they don't live here, they don't know what's going on. And we were able to help them. However, if you don't have somebody that can help you, that is a real problem. And these community outreach personally, I think it's an excellent plan to be able to reach the elderly. I think, though, I don't know, tell me, I feel like still more needs to be done.
I can tell you more needs to be done. Last Saturday, we do a monthly food distribution at the auditorium. And I actually really enjoy going, because sometimes it's awkward to say that, but because folks are coming there and have been coming there since last March. So we're on a year of doing this, but we all know each other and we can share each other's stories. And sometimes they're good stories. Oh, I got my job back. And sometimes they're sad stories. My mom's in the hospital. But in general, I kind of get there early and I just knock on all the car windows and we talk to people. And last weekend, I knocked on the window, and some of them are older people. I said, have you gotten your vaccine? No, I don't know how to get that. So it's there. We may have to go back to the basics of knocking on people's doors. Mm-hmm. And I did that at the beginning of the pandemic because I started to look at where the highest incidence of COVID cases were. And they were literally in East Little Havana, in the very poor neighborhood. And I put out the bat signal. I got tons of volunteers. I need help. The Kiwanis came, all these people, Amigos for Kids, everybody came, and we literally knocked on 2,000 doors over a weekend in the census codes that have the highest rate of COVID. And it may just be that when we begin to get more vaccine availability, we're just going to have to do that. As much as we think we're communicating via media and TV and radio, working families are busy. They actually don't have a lot of time for media. Forget about social media. Mm-hmm. Their kids are coming home from school, or they're, and they're doing this. They're working 2 jobs if they're low income. And that message, I knocked on these cars' windows. We talked to these people. None of them knew how to sign up for a vaccine. And I said, there's a phone number. Like, there are 2 phone numbers. There's a state number and a county number. You can pre-enroll. And then when the state or the county gets the shot, we will call you up and let you know that you could come on whatever, Thursday. So there's a lot more that needs to be done. For now, vaccine supply has been limited, so we're able to fill every shot. But as time goes forward, we're going to have to be knocking on doors with little flyers, which is very old-fashioned, but
it works.
It works.
It works. When you want to get the word out, nothing, in my humble opinion, nothing can replace good old-fashioned knocking on doors. Yeah. I mean, it's very time-consuming. It requires a lot of volunteers or paid staff, so it's an expense possibly, but nothing, I think, can replace human-to-human contact. Which we've missed so much this past year. And funny enough, this weekend, my husband happened to be in a home of a senior who is actually, you would think, very internet savvy, and said, hey, I haven't been able to get a vaccine. We were very shocked because this is a very, well-known person, and we were very shocked. And, my husband said, you know what, let me get on the Jackson website and see if we got lucky. And him and his wife got appointments for that very same day. So they're there. And if people need to know more about how to get a vaccine, of course, they can always call your office, 305-375-5924, and get the information, possibly those phone numbers, get more information about another vaccine operation with another church. But they can always call your office. And since we are on this subject of the vaccine, this week was announced, there were several announcements. This past week was announced that CVS, IMAS, and Navarro were going to start distributing vaccines, as well as the governor making the announcement that teachers, police, and fire above the age of 50, I believe it is, could also start getting vaccines. And you are learning about this as well as the rest of the public is learning about it. What has your office heard about this situation?
Well, from as far as I know, if you now meet the governor's qualifications, you're a particular. What I'm extremely excited about is that teachers now and school employees that are over the age of 50 are included in this. You can now go on to any of the vaccine sites, no matter where they are, whether they're a pharmacy, a county site, a state site, or the new federal site that's opening on the 3rd, right, up at Miami-Dade College North, and you're now eligible. I believe pre-existing conditions, if you don't meet those new characters, the new qualifications of police or educational teachers, personnel, if you have an underlying condition, you can continue to go through one of the hospitals like Jackson or the pharmacies. And my understanding is you'll have to provide some kind of proof from your doctor that you have diabetes or, a lung condition.
There are several things, including morbid obesity, diabetes, lung issues, I believe
Asthma. I think asthma, right?
asthma, different types of cancer and chemotherapy treatment. So there's a list, but I think the best bet is to call your doctor and find out. And then again, that creates a divide once again. Who has easy access to just pick up the phone and call their doctor, you know?
Yeah.
So people with health insurance. So now we're getting to another divide, but there has to be a way to do this. So we have to start somewhere. And I think that being able to at least offer this and getting our teachers and our police officers and firefighters who are in the front lines is so important, because the firefighters don't hesitate if they have to give you mouth-to-mouth resuscitation.
Yeah. And I really would like to see our corrections officers get vaccinated. The men and women that work at Miami-Dade Corrections, they don't have an easy job. And our jails folks are coming in, maybe they were too drunk, they couldn't get home, but you really have people going in and out of them. And we've had a high rate of COVID among our employees there. And I am hoping that the governor will allow corrections officers to be listed now as police and get vaccinated, because they deserve it. They work hard and they work in a high risk environment where people are constantly coming and going.
Yeah, exactly. So these are all people that are in the front lines dealing with a lot of the public that serve a service for government service. And also, speaking of taking care of our elderly like we were before, you've also worked with World Central Kitchen to do a program to provide hot meals for seniors. Now, what's really cool about this program, as I was reading about it, is that it not only helps our elderly, who again, in many cases are stuck at home because maybe they're not only elderly, they also have other conditions, and so have to be very careful. They're stuck at home, they get these hot meals from these restaurants, but it helps small businesses. Can you explain to us how it helps small businesses?
Yeah, this program, I think everybody knows Chef Jose Andres. He's world famous for helping people everywhere, all around the world in crisis. And God bless him, because this has been one long crisis. And he's committed also to helping people here in Miami. His program is really innovative because it's a partnership. They literally go into restaurants that are struggling, and they ask these restaurants to prepare hot meals, and the restaurant owners are able to employ their employees. And then what he's asking from people like me who work in the neighborhoods, right? Where are people in need? And of course, in District 5, we have a lot of seniors in need. They've been isolated. All of the comedors, our little lunchrooms, have been completely shut down. So they've been eating by themselves, and we have been delivering food, some of which they cook, but it's a lot of work. And then we have people that are homebound. And so we've been creating the connections, and it has been great. We worked with El Cristo restaurant from Calle Ocho, and Jose was just thrilled because he's been able to bring more employees back. And I have another little restaurant in Miami Beach, because we have a lot of seniors in Miami Beach that are very isolated. Sometimes we always stereotype Miami Beach as the tourists, but in the little historic buildings, there's a lot of seniors. And the restaurant there, Le Petit Bistro, was literally out of business. And they've come back, and they may or may not be able to afford opening their restaurant anytime soon for the public, but they've got a food truck that they'll be able to start. So again, it's resuscitating these small businesses. So we're helping small business and we're helping our neighbors, and that just feels really good.
It's a great combination, absolutely. Yeah. Well, Commissioner, I really want to thank you for taking time out of your day. I know you have a busy day today, as every day. And I wanted to thank you. I want to, one more time, put the information for your office here on our screen so that anybody can reach you at any time. And of course, here are all of our social media channels. But you can always use the old-fashioned telephone.
It works.
Give them a call and say that you watched it here and that you want to find out more about all of these great programs that her office has to offer to help the residents of Miami-Dade County during this difficult time. And please, Commissioner, I know that you're out there all the time. Stay safe and take care of yourself. Is there anything you would like to add to this?
No, these are just difficult times. I just want to remind everybody, we talk about the vaccines a lot, but we still have the virus, right? Mm-hmm. So, and so you've got to still be careful. out there because we don't want it to get you before we get to your arm with an injection. So be careful, continue to wear those masks, wear your masks.
Wear your mask, keep your distance, keep elbow pumping, right? Elbow pumping instead of hugging. It's very difficult. Smile with our eyes. It's very difficult in Miami to remember that we can't hug each other, that we have to keep doing the elbow bump. But this is at least, this is what we have to do to keep each other and keep our families safe. So thank you so much, Commissioner, for joining me here today. And thank you all for watching this week's Influence Stories. And remember to join us every Thursday at 5 o'clock in all of the Influence Communications social media channels. Thank you so much and have a wonderful day, Commissioner.
Bye-bye. Thanks.
Bye. Thank you.